So, welcome to today's episode where we will delve into a condition that affects millions of people worldwide, which is asthma. So, stay tuned whilst we talk from its symptoms to triggers to its management and explore the complexities of this respiratory condition and shed light on living well with asthma. Hope you enjoy this talk. So, Trudy, let's start off by just explaining what asthma is for those that don't know what asthma is.
Okay, so asthma is basically a respiratory condition that is normally characterized by inflammation and narrowing of the airways. So the breathing airways get smaller and they maybe sometimes get inflamed, and therefore you have difficulty breathing. Now, it is sort of like characterized by recurrent episodes of wheezing, breathlessness, sometimes chest tightness, and even coughing. Most asthma patients will actually experience coughing as almost like as a symptom of like a flare up.
Yes.
Now, these symptoms are often associated with, of course, airflow obstruction, and of course also sensitivity to, say, some triggers. So if something triggers the airways to either narrow or become a bit inflamed, then they will experience some of these symptoms. Now, asthma is typically diagnosed based on combination of symptoms. So just because maybe you're having a cough and maybe you're wheezing as well, doesn't necessarily mean you have asthma. It could mean maybe you have other respiratory conditions, or even just a common cold, because these are also symptoms that can be associated with that. But a combination of symptoms, and of course medical history, and also physical examination. And what we also do is we also carry out a pulmonary function test, just to see, of course, lung capacity and things like that. This is how we would normally be able to diagnose asthma. Now, just to mention as well that asthma does vary in how severe it can be with different individuals. So some people can have just very for lack of a better word, minor symptoms, where it's just a little bit of a cough that's maybe keeping them up at night or maybe waking them early in the morning. And then there's people who will have a cough all through the day. So asthma does vary with different individuals. And of course, as we've mentioned, it can be triggered by various factors, which we'll probably talk about later on. But that is the basic definition of what asthma really is. Now, just talking about sort of the symptoms, I've mentioned just a few in passing, but Steph, do you have any that maybe I've not mentioned, or any add-on as to why this would be classified as symptoms of asthma?
No, I think you've basically gone through all of it. Like the typical symptoms of asthma is the wheeziness, the breathlessness, a tight chest, like, when you feel like you have like a band tightening around it, the coughing, which you mentioned. And typically with the asthma symptoms, it usually happens often and it keeps coming back, unlike, like a common cold, like you said. So that's when you notice that, okay, no, this keeps coming. It keeps coming back. It's not going. Often as well, the symptoms are worse at night and early in the morning, as you mentioned. And it's usually triggered by something like maybe exercise or so, like, we will go through them. But you've mentioned all the symptoms that are typical of asthma. I don't know, some people also have there's this term that we normally use, which is an asthma attack. So I think we should delve into that and talk about the symptoms for that as well. And then we would go into like the triggers. So asthma attack, you may be wondering, like, you probably hear that often, like maybe someone is having an asthma attack. So as an asthma attack is usually when the asthma symptoms get really worse. So in a very short time, and is usually when the symptoms are exacerbated. So it can usually happen suddenly, or it can progress like gradually over a few days, and like the symptoms of it are usually the typical signs of like asthma, but in this case it's more severe, and it's worse. So you still have like your wheezing, your coughing, your chest tightness, but when you have an asthma attack, it becomes more severe, and it's constantly there. So that's the difference when you're having an asthma attack. Also, you do get breathless, but in this case, sometimes like you get so breathless that you can't even speak properly. You probably can't sleep, can't eat properly. It's really, really, really bad. Like it's quite
Gets in the
severe.
way of life.
Yeah. And also during an asthma attack, you may find out that maybe you're breathing a lot faster as well, and which also comes with like maybe your heart beating a little bit faster. So that's why they call it an asthma attack. It can get really, really bad for some people, where it can cause a bit of like drowsiness, a bit of like confusion, and they even feel dizzy. And at times when like it's getting really bad, like the airways tighten so badly, it can cause people to actually have like blue lips or fingers, because they're not getting enough air into their lungs. So it could cause them to literally go blue because they're not getting enough oxygen, which also sometimes asthma attacks can lead to fainting. So when it comes to asthma attack, the symptoms are a lot more severe than a typical like asthma. Yeah. So with asthma attacks, it's usually like an emergency, basically. Yeah.
Yes. And it's good that you've mentioned the whole sometimes the lips and maybe fingertips going bluish, because it can be confused for certain other conditions. So and because the person who's having an asthma attack might not be able to speak, they won't be able to explain exactly what it is. So it's just really good to know some of these things. So you don't, you could literally start doing something to this person, not knowing exactly what it is that's going on. So if you, I think, do you know what? I always say this. I think asthma patients should wear like a band saying, I'm asthmatic or something like that, because asthma can be confused for so many things, especially an asthma attack can be confused for so many different things. Yeah.
Yeah, I totally agree. Okay, so we did mention that asthma can be caused or triggered by certain things. So Judy, should we go into it now? Like, talk about the different things that can, trigger your asthma.
Yeah. We should. Now, most asthmatics, not every asthmatic, but most asthmatics will experience something that makes their asthma slightly worse. Now, there's different things that could potentially cause your asthma to be quite bad, or just cause a flare up of your asthma. Most of the time when we're doing asthma reviews, we do ask patients, do you have a trigger? Sometimes they know what their trigger is. Sometimes they can't really pinpoint what could be their trigger, but there is different things that can trigger asthma, or can trigger even an asthma attack, that can cause you to have that flare up, that exacerbation, which can of course cause worsening of asthma symptoms. So most of the time, cold. So most asthma patients will say that when it's cold or even when it's damp, that really causes the asthma to flare up. So during these times, it's just a matter of doing, what you can to avoid maybe cold, damp situations, making sure the house is, in adequate sort of like it is adequate enough that there isn't any damp or anything like that, because if you live in a house with damp and you're asthmatic, that will literally just cause your asthma to flare up. some people also, when they have like a respiratory infection, so if they have like a chest infection, that can also
Yep.
cause their asthma to flare up, which is, it kind of makes sense, because it's
Yeah.
all the breathing system, isn't it? So yes, that can actually cause a flare up in the asthma. Some people also have things like pet dander. So and the funny thing about this is, a lot of asthma patients, I say to them, "Oh, do you have a trigger?" They say, "Yeah, pet dander." And I say, "Okay, do you have any pets at home?" They do have pets at home. So that could
Yes.
kind of explain why maybe they're having a flare up so often.
Yeah.
But yeah, so some pets, the far from pets and things like that can actually cause a flare up in a lot of patients. Some patients are actually quite severe, that if, say, they were in a room and there's pets, that can cause their asthma to really really flare up, or even
Yeah.
that can cause them to have a not heart attack, an asthma attack.
That's what
Um,
yeah.
yeah. Another thing that patients also mention is smoke. So some patients have smoke as a trigger. Smoke, perfumes, anything sort of like they might inhale
Mm.
strong, strong perfumes, strong smoke, things like that can actually trigger the asthma, or cause an asthma flare up. Just think of any other things that maybe any patients have mentioned. Can't think of anything else top of my head, Steph. Anything you can
Okay.
think of that would be
I
a trigger?
think,
Or
yeah, when it comes to triggers as well, one thing we normally say, like when patients are asthmatic, we normally warn them that when, like, let's say for instance they're in pain, they should be careful about like the sort of like painkillers they go for,
tea?
because in
Yeah.
particularly anti-inflammatories like
Mm,
ibuprofen and aspirin can trigger their asthma.
yeah.
So if you're someone that you realize, oh, after taking this medication, I normally get an asthma
Mm,
attack. Yeah, it's
yeah.
probably because of the ibuprofen or
True.
aspirin. Yeah. I'm not sure if you mentioned this, but exercise as well
Oh yes,
can
exercise
sometimes,
induced
like,
asthma.
trigger your, yeah, it can sometimes trigger your asthma.
Mm-hmm.
Only because, it makes you really exhausted. Breathing a lot of, you need a lot of oxygen as well. So sometimes,
True.
the exercise can trigger the asthma. I think you mentioned most of it, like as you mentioned, cold and flus,
Mm-hmm.
allergies like pollen, that sort of thing can trigger.
Yeah.
The smoke, especially the weather,
Mm-hmm.
mold. Yep, that's
Yeah.
basically, yeah. So those are
I,
the triggers.
I think also something like stress. I think stress is also something that
Oh
triggers asthma.
yes,
And some
yes.
patients don't realize it, but like when there's like maybe they have anxiety because of something,
Anxiety.
that can cause a stressful whatever, or even
Yes,
anger, that can really trigger your asthma. So if you're
yes.
asthmatic, just be mindful of some of these things. If you're maybe anxious or anything like that, just make sure you have inhalers there,
Yeah,
because that could trigger your asthma. Just worth mentioning.
yeah.
Mm,
Okay. Okay, fantastic.
yeah.
So it's also worth noting that there are a number of things that can increase your chances of like getting an asthma. So for instance, if you're someone that has like an allergy related condition, such as we've
Mm,
mentioned in the past, like hay fever, or maybe eczema or a
mm,
food allergy, um, most of the time you will realize that in patients that have these conditions, they also have asthma.
that's it.
They're kind of like related. Yeah. So most of the time, yeah, you will find that if you have asthma, you probably have these conditions as well. Another thing is that maybe your family history. So let's
Mm,
say, for instance, your parents have asthma, it is likely that, you may also be asthmatic. Not all the time, but it is a risk factor.
mm,
Yeah, sometimes maybe when you were born, you probably had like a childhood lung infection, so which can increase your risk of also getting an asthma.
mm,
Um, or maybe like a child that has been exposed to smoke when they were young can later on get asthma.
mm,
Um, or maybe during pregnancy, the mother was smoking, which can also increase the risk of the child getting asthma. So these are all risk factors, as well as like the triggers that are triggers asthma. These risk factors also increases like your chances of getting asthma. So it's worth noting, like, if you have an asthma, to check what is triggering it or what is causing them. But I think one thing that we didn't mention is that some people get asthma through the work that they through their job, basically their occupation is due to like the substances they encounter.
They inhale.
So this is normally known as like occupational asthma, so which means like the causes of like the asthma is due to like the substances that they usually encounter when they're working. So for instance, someone that like a painter, like, they use like a spray paint or something. Most of the time they said the chemicals in the spray paint can actually like trigger asthma and cause asthma. So you just need to be careful if you're someone that works in that sort of field.
That's true.
I don't know about you. I don't know if you've heard it, but bakers as well are at risk because of like, sometimes they use like the flour.
I think the flour,
they use.
Even if you're not asthmatic, I don't know if you've realised that sometimes when you're baking or you're using anything that's got flour, you just start sneezing. It's like you get like almost like hay fever symptoms. So yes, it makes sense, because anything that, I suppose, any allergens that can sort of go into the respiratory system could cause that, couldn't they?
Yeah. There's a whole lot of like occupations that can like, cause put you at risk of like getting asthma. So there's quite a few, like animal handlers, like timber workers, even nurses, like, let's put it out there, because of like the chemicals they come encounter with. So many. So just be careful if you are in these sort of fields, and you are at a higher risk of like being exposed to substances that can cause or trigger your asthma. So just be careful if you are in these professions.
100%. And we're not saying, quit your job or stop going to work and tell your employer that, listen, some pharmacist told me that this is what's causing my asthma, and my asthma is really bad, so I quit. No, we're not saying that. There is ways to manage your asthma. So, but just, of course, be careful that some of these, if you work in some of these places, it could be the reason why maybe you're having a flare up of asthma.
That's right. That's right.
Well, I suppose talking of management, how do we manage asthma? Is there treatment?
Yes. So if you think about the way asthma is, so it's like the inflammation of like the airway tubes, which narrows. So it causes the asthma symptoms. So there are a few medications that are used to help control symptoms of asthma, just so that, you can live a normal life and be active, So I'll go through a couple of them. Just going to go briefly into them, not too much, so that, you get confused. So,
and I think also it's
when it comes to
worth mentioning before you go through all them is asthma treatment is normally tailored to individual. So we're talking about general idea of what you could possibly get. If you're not on any of these medications, don't go to your doctor and say, I heard somewhere that I could be on this. Why am I not on it? It's probably not tailored to you.
So just to talk about like the treatments that are commonly used, so as you're aware, you normally find that the patients are on inhalers. So when it comes to inhalers as well, there are different types. So as Truda mentioned, so usually as a personal action plan is created for you by like a doctor or an asthma nurse, and with the inhalers are classified as ones that relieve your symptoms when they occur, or they stop symptoms developing. So we have the relievers, which relieve the symptoms, and we have the preventer inhalers, which stop the symptoms developing. So some people might need either both or just one or maybe a combination of them. So I'll start off with the relievers. So as I mentioned, the relievers, what they do is that they help to treat your symptoms when they occur. So when you're having the asthma symptoms, they will usually relieve your symptoms within a few minutes. So most people know this inhaler as the blue inhaler. They usually refer it as the blue inhaler.
Yes.
Yeah. That's what most people would refer it as.
I don't even think they know the name of it. They just know it as a blue inhaler.
I don't even know if I should mention it.
We'll go with
Let's
the blue
just stick
inhaler.
to it as like reliever inhalers and known as the blue inhaler. But you know, in the pharmacy world, you know, they do contain salbutamol. The common ones are like the Salamol, which most people have, or the Ventolin. So I'm sure like most people are aware of that. So as I mentioned, this blue inhaler usually relieves your symptoms when they occur within few minutes. So when it comes to using your blue inhaler, we normally say if you're using your blue inhaler 3 or more times a week, this may suggest that, like, you know, you may need additional treatment. So that's when we may have to add on a preventer. So a preventer inhaler, it's often used to stop the symptoms of asthma developing. So this preventer inhaler usually reduces the inflammation and sensitivity of your airways. So it stops the symptoms occurring. One thing I would say is that it's important to use this inhaler every day, because one thing I notice is that some patients will say, oh, I've stopped using my preventer inhaler because I no longer have the symptoms. But the reason why you don't have the symptom is because the preventer inhaler is doing its job. It is preventing you from having those symptoms. So just because you're not having an asthma symptom anymore does not mean that you need to stop using your preventer inhaler. That is one thing. It's very, very important to note. This preventer inhaler usually contain steroid medication. This is what helps reduce the inflammation of the airway. So with steroid inhalers, you may notice that sometimes, you know, it does come with a few side effects. That does not mean that you should stop using your inhaler when you get these side effects. So side effects may include like fungal infection of the mouth, which is normally known as oral thrush. So you may get it in the mouth or in your throat. Sometimes it may cause like a hoarse voice or a sore throat. So please, when that happens, do speak to your healthcare providers, because there are measures in place that can help reduce these side effects. So I normally like tell my patients, please rinse your mouth after using the inhaler, because this prevents you from getting the oral thrush. Or sometimes if it's still occurring, what we normally do is that we may advise you to use like a plastic tube to attach to the inhaler, which helps deliver the medication straight into your lungs. So it's a lot better and reduces the chances of getting the side effects. So first of all, so as I mentioned, when it comes to your treatment, it is tailored to everyone. So although you may start with like with the reliever, you may then progress on to adding on the preventer. But in some cases as well, just using the reliever and the preventer is not enough. So some patients may actually be put on like a combination inhaler, which contains both the preventer and the reliever. So it's a combination of both. So it helps stops the symptoms occurring, but it also provides like a lasting relief if you do have like an asthma symptom. So this is usually quite effective. And you find out that most patients are actually on like the combination inhaler, especially when their symptoms is not being relieved. Side effects are similar to like, the reliever and the preventer inhalers. I just realized that I didn't say the side effects of the reliever inhaler. So that one is usually, because of the way it works, it may cause your heart to beat a little bit faster and sometimes cause a bit of shaking. Not to
Yeah.
worry about. These are symptoms that usually like, go away after some few minutes. So nothing to be worried about. Yeah. So these are the main inhalers that are used. So your reliever, which is the blue one, your steroid, your preventers, which contains the steroid in medicine, and then the combination of both. But there are plenty more
Yes,
plenty more treatments out there, but these
there
are the
is.
main ones I will focus on. And I
Yeah.
mean, there are some people who go on like some tablets to help them sleep at night, or some
Even
people
to
also go
help
on
with asthma symptoms. So,
Yes, yes. Some people also go on some capsules to help them bring out mucus. So there's so many different treatments out there, but
yes.
those who are the main ones I wanted to focus on. Or True, did you want to go into them? Should we?
No, I think it doesn't make
Yes.
sense to. The reason I think that is the case, and of course, by all means, if you feel like you want any, further information, send us an email.
Yeah.
Find us on our Instagram, send us a direct message. We will respond to you. But the reason I think it
Yes.
doesn't make sense is, as we've said before, is what we've said before is medication for asthma is very tailored to an individual, depending, of
Yes.
course, also with what type of asthma you've got. If say you've got just say an exercise-induced asthma, you might not necessarily take the same medication as someone who has maybe chronic asthma. And then, of course,
Yes.
there's childhood onset asthma, and then there's adult onset asthma. So every individual has got a tailored concoction of medication or
Yes.
remedies for asthma. But it just makes sense to mention because it will almost, like I would say at least 90% of patients are on the ones we've just talked about. They'll be on a reliever
Yeah.
and a preventer, which has got a steroid. But then now the other add-ons would normally be, maybe you're using your preventer, and it's not necessarily, you're still having symptoms and you're using maybe your reliever a lot more often than maybe 4 times
Yeah.
a day. Then you might be put on some add-on just to help with sort of symptoms, especially if maybe these symptoms are at night. As you said, Steph, some of them will help you with sleep. So depending with
Yeah.
exactly what is going on, how your asthma is responding to the treatment, you will be put on the correct treatment for
Yeah.
you. But by all means, if you want any extra information, drop us an email, send us a direct message. We will most definitely respond to you as to what we feel. If you say you're an asthma patient and you're not sure what's going on, please send us an email, a message, and we will respond to you. But that is, it makes sense for us to just mention those very common ones that are,
Yeah.
but used by majority of patients who are asthmatic. You did mention something, and I think it's worth talking about it, which is steps to take after using an inhaler. The reason I say this is a lot of people don't even know how to really correctly use their inhaler. So I think part of this episode, what we'll do is we'll also drop maybe in our YouTube, maybe drop a link as to a video that shows you how to use your inhaler properly,
Yes.
because some people really struggle with that. So that is probably
Yeah.
the reason why you're not getting relief from your inhaler. It could be that maybe you're not using your inhaler properly. But you mentioned
Properly.
something that, we always tell our patients, rinse your mouth after using, say, a steroid inhaler, just because that can cause oral thrush, which is something that is very, very common. Like I can count in one, in both fingers times and say a month
Yeah.
people say to me, I've got this because of my inhalers. But there's also other things you have to do when it comes to inhalers. So other steps you have to take just to make sure you're doing what is correct in regards to your inhaler treatment.
Yeah.
So some of it would also be cleaning the inhaler. So depending on what inhaler you're using, it might be worth cleaning it. Just any buildup of, let's say, medication residue, or even any dust that might have formed around that. Because if dust is a trigger, and then there's dust around your inhaler, and you're using this inhaler, you're basically, it's like you're counteracting exactly the use of the inhaler. So some
Yeah.
inhalers, you need to clean them if necessary, of course.
Yeah.
just to clear any sort of buildup of medication residue, and also, as we said, dust, and also replacing the cap of the inhaler is very important, because it can build up, dust can build up in that area, and you're going ahead and sort of inhaling that. So again, just replacing that as soon as you use it is very important. And also storing it properly. A lot of people actually just leave their inhalers everywhere, because that it's like something that you use very often, isn't it? So you feel a need that, okay, I'm just gonna just chuck it, in the glove box in my car. It's collecting dust, it's collecting every kind of thing, name to man, or even like in direct sunlight, or in extreme sort of temperatures. Again, it's medication that is contained in this inhaler, so you're not really you're basically changing even the formulation of this medication. So things like that. And also just following, you mentioned something, Steph. You mentioned an asthma action plan, or an asthma agreement plan. So following this plan is very important. And if you feel like maybe you followed this plan, this recommended steps, and it's not really helping, maybe you're still getting frequent asthma attacks, speak to your healthcare professional, speak to your doctor, your asthma nurse, explain to them exactly what's going on. It could mean that maybe there's something else that's causing this trigger, and then that will be looked into. And also just monitoring symptoms. If we always say, if you experience worsening symptoms, or you feel like maybe your inhaler is not as effective as it has been previously, contact your healthcare provider. Let them evaluate you and guide you as to what you need to use, what you need to do. So when it comes to inhalers or medication, I think I can't emphasize this enough. It's very tailored to what your symptoms are, and to how you're responding to the treatment. So always speak to your healthcare professional as to what is the correct treatment for you. If there's any sort of worsening symptoms, anything like that, just speak to your asthma nurse, doctor, healthcare professional.
Fantastic.
Yeah.
Okay.
It's worth mentioning as well. I don't know if this was at uni or it was during my pre-reg, but when I was a few years back, I did hear something. I think it was probably during pre-reg, where someone said that they gave this gentleman, or maybe it was just something that was going around, I do not know, maybe you've had it anyway, Steph. There was a guy who come into, he went to his doctor, and he was told, yeah, you're asthmatic, and your asthma is being caused by your dog. And the doctor gave him a prescription for inhalers, and he went to the pharmacy, got his inhalers. He went home using his inhalers, and a month later, he goes back to his doctor, and he's like, or to the pharmacist, I am not too sure. This was a while back, okay? So this story is a little bit, it's picked up all kinds of, so it might not be very accurate. But he must have gone back to either his pharmacist or his doctor and said to them, look, I've been using the inhaler and the symptoms are still there. And then they're like, okay, let's do a consultation. Went through everything. And then they said, how do you use your inhaler? And he said, well, I just put it in the dog's mouth, and I just let the dog use the inhaler. And so they were like, hold on, wait. So you're not using the inhaler, it's your dog that's using the inhaler. He's like, yeah, you told me that the dog is causing my symptoms, so I thought the treatment was for the dog. So the dog has probably been, like, maybe the dog had asthma as well, and the dog has been living his best life. Like, okay, my treatments are sorted. But, the patient has been suffering all through. So he was told, no, the treatment is for you. It's for you to use. Yes. So, and I say this, with a smile on my face, being all joking about it. But I am so sure that this is a story that actually happened. I don't think it's hearsay, or it's even like, a joke. No, I'm sure this happened, because a lot of times people don't realize some of these things, So the inhaler we're talking about are for you individuals, you patients.
Not the triggers.
Not the triggers. And I've worked in a pharmacy where we actually did private prescriptions. And we did a lot of prescriptions for even pets, like a lot of inhalers. We were giving it inhalers for dogs and cats. So I understand your dog could have asthma, but if you've been given medication because you're having symptoms, please use that inhaler on yourself, not on your
Yes.
pet, please. Not on the person who's causing your
Yeah.
symptoms or causing your stress. No, on yourself, please.
On yourself, yes.
Yeah.
That is very important, Trudy.
It is. I think it is.
Yeah. Fantastic. Yeah. I think you've mentioned a few things that people need to do whilst they have asthma just to help, like, I think we do need to go into like the lifestyle as well as like some of the things that people can do to help them to help with your asthma, as well as like using your inhaler correctly, using your preventer every day. I think you should look at your lifestyle. If you are someone that smokes, we do know that smoke triggers asthma. So we normally advise patients that you need to stop smoking, because smoking can increase like the severity of your asthma. So by stopping smoking, you may find that like your symptoms actually do reduce. Also, exercise regularly. As much as like exercise can trigger like your asthma symptoms, it is appropriate to also say exercise regularly, because if you're unhealthy, you're not, it's gonna make your asthma worse. If you're obese or something, it's gonna make your asthma worse. So do exercise regularly. We're not saying like rigorous exercise or something, but even if it's just like a simple walk, like as we mentioned in our previous podcast, like exercising can mean like going for a walk for like 30 minutes. These all help. They do say when you go for a walk here, it opens up your airway. I don't know if you heard that, like, because you're breathing in like fresh air.
Exercise improves lung function. Anyway, it has been known to increase improve lung function. So, as much as your exercise could trigger your asthma, do not avoid exercise because of this. There is ways to manage it, and with proper management and precautions, people who have asthma can actually participate in physical activities and sports. Like, we know some athletes who are actually asthmatic, but they're out there, so
Exactly. Yeah. And also you normally advise most asthma patients as well to eat healthily, eat a normal diet. It is quite important. Diet, we always say, plays a major role in our health. So make sure that you're eating healthily. Exactly.
Yes, no, definitely.
Yes. Make sure you also get vaccinated, for your flu vac, because we do know cold and flus also triggers your asthma. So if you can, it is a good idea to get a flu jab,
If it's offered, take it.
Exactly.
Yeah, if it's offered to you, go for it. 100%.
Yes.
And I think it is free for people who have some respiratory conditions.
That's right. Yes.
If a free flu vaccination is offered and you have been getting quite a few flare-ups, a few attacks, please go for that flu jab. Exactly. It is going to be beneficial to you.
Yes. And other ways as well that people can, like other things that people can do as well to help with your asthma, as we mentioned, making sure that you identify what is triggering your asthma and making sure you avoid it. That is the major thing. If animals are the ones causing it, or if it's a medication causing your asthma, it does make sense to avoid them. One thing I will say is that make sure you go for your regular checkups. They do have asthma checkups. You need to go for your asthma reviews. It's very important, and we normally recommend it once a year. So make sure that you contact your nurse or your pharmacist or your GP just to go for that asthma review. This is important to go there so that they will monitor like your symptoms to make sure that your symptoms are not getting worse, they're not affecting your normal activities. If it is getting worse, obviously then they'll add on your treatment, but that's why you need to go for your checkup so that they can check all of these things. It's also important to go for your checkup so that they can discuss your medications for you in case you're experiencing some side effects, so that they'll be able to help you manage those side effects or even change up the medication. And most
Yeah.
importantly is to go for the breathing test to make sure that, your asthma is not getting worse and it is improving. As you may mention, I think Trudy already mentioned it, which is like we do the peak flow meter test. So it is
Yeah.
important to go for the checkup so that you get this done.
Yeah. And I think also,
Yeah.
speaking of, Steph, a peak flow meter it's a device that you can actually have if you're asthmatic. You can actually have this at home with you. So
Yes.
if you feel like you could benefit from it, it might be worth sort of like just speaking to your healthcare provider just to see if you could have a peak flow meter,
Yes.
only because it just helps to basically just check your lung capacity just to see how well air is moving in your lungs. So if you're having, say, a flare up or you're having an infection, you can just check and just make sure that your lung capacity is still okay, just for you to be basically you're managing your asthma the best way. So when you need to maybe get in touch with someone about something because maybe the levels are quite low, the readings are quite low, or if you will know what your standard reading would be when you use a peak flow meter. So if it's outside of that range, then you know how to manage that. So it is something I think it's being offered quite readily in a lot from a lot of sort of surgeries. So if you feel like you could benefit from one, please go ahead. But I don't know about you, Steph, but sometimes when I do an asthma review, I say to the patient, do you have a peak flow meter? And they're like, yeah, somewhere under my bed or somewhere in the kitchen.
Yeah.
Look, it's not supposed to just sit somewhere and collect dust, okay? It's supposed to actually help you. So it is somewhere that you can reach, you can reach easily, just for you to be able to use it. It's all like collect dust, because if it's collecting dust and then you're using it, come on, you're not doing yourself any favors. So if you're gonna get a peak flow meter, just make sure you're also storing it properly. It is somewhere that it's nice and clean. It's basically one of your medication as well. It's one part of your treatment. So it's worth noting that as well. Yeah.
Fantastic.
I've had a few myths about asthma. We always talk about myths here, but I've had a few, not too many, because I think asthma is one of those things people either know exactly what it is. There's a lot of asthma is, in a lot of movies you'll see that someone has an asthma attack or something. So people know a lot about asthma, but I have heard a few myths about asthma. I don't know if you've heard of any, Steph.
Yeah.
So
I think one thing I don't know if it is a myth, but one thing that has been really common for me is that, sometimes you ring a patient to do a review and you see that, okay, they haven't used their inhaler in for so many years or something like that. And then you call them and they're like, yeah, I don't have asthma anymore, so I've stopped using my inhaler.
Exactly.
I'm like, really? Really? Okay. So sometimes this actually gets me a bit worried.
Agitated.
I'm like,
for me, agitated.
It gets me really worried. I'm like, okay. Well, you may not be having the symptoms now, but that doesn't mean that your asthma is gone, is cured. Asthma cannot be cured.
It's progressive respiratory
it
condition.
Cannot be cured. So sometimes when patients say, oh yeah, my asthma is cured, I don't have, I'm like, no, asthma can't be cured.
You can control your symptoms.
Yes. You may not be having some symptoms now, but I feel like people need to be wary. They need to go for their asthma checks, make sure that everything is okay. Your inhalers, make sure that they're in date as well, because some people have
that's important.
the blue inhaler tacked away because they say they don't have asthma, tacked away, and it's expired, and you never know. One day you may experience that symptoms. So just because you're not having some symptoms now doesn't mean that you will not have it later on. I do understand that some patients, maybe they did have childhood asthma, and then sometimes, as an adult, it does actually, does go away. You know, I do get that. Like sometimes, like some people are outgrowing it, but it can appear in some adults after, you know, even after having the childhood asthma, like later on it may
reappear.
occur. But some people say yes, they don't have it in their adult life, which fair enough, but
you might not have the symptoms. It doesn't necessarily mean that you do not necessarily have asthma, or you know, the asthma is now non-existent and it's now a completely different thing. No.
But as we mentioned, you know, family history plays like a major role in like getting asthma. So if your family does have asthma, you did have like a childhood asthma, most likely I would say that, you know, the asthma symptom still remains and it could be triggered later on in life. So people just need to be mindful about that when it comes to that.
That is true.
What other myths have you heard?
I think you've mentioned something. So some people associate asthma with children. So some people think that asthma is only children can get asthma. Some people actually develop asthma later on in, you know, in adulthood. So it doesn't necessarily mean that it is a childhood thing, or it's a, you know, child onset asthma, and after that there's no, you know, you cannot get asthma. No. Adult asthma is not uncommon, and it is normally triggered by various factors. So adults can also get asthma even if you didn't have asthma as a child, but we have already spoken about that. I think we also spoke about something, and I hear this from a few of my patients, where they say that people with asthma should not really exercise, you know, because I say to him, so, you know, do you exercise, or, you know, does he stop you from exercising? Like, no, I have asthma, I cannot exercise, I should not exercise. But we have said that that's not the case. Regular exercise is generally beneficial for everyone, but also for people with asthma. So it can help improve lung function and also overall health. And of course, if your health your overall health is improved, of course you will do better. So with proper management, just as long as you're talking to your healthcare provider, you know, just to manage your asthma the best way possible, you can certainly participate in physical activity. So that is a myth, that you should not exercise because you have asthma. I think the only other one I've heard is, and I think you've probably mentioned it, is that asthma can be cured. You know, I've said that asthma symptoms can be controlled with great treatment, with a good treatment plan, but there is currently no cure for asthma. Now, treatment normally focuses on managing symptoms, preventing asthma attacks, and also improving quality of life, but it will not necessarily be aimed at curing asthma. So that is a myth. You know, when you say, no, my asthma is cured. Most people say, I went to Tenerife, I came back, no asthma. My asthma is cured. No. Tenerife did not cure your asthma, darling. Okay, because there's no cure for asthma. Any others you've had, Steph?
I think those are like the main one, apart from maybe like the weather as well, you know. I'm just thinking, what other myths? I
think some people say that asthma is a psychological condition, you know. When like someone's coughing, they're like, oh, it's my asthma, and they're like, oh, that's just that's just your mind. It's not quite the case, you know. I think someone who has asthma would know when maybe they're having a flare up or when they're having an attack. So it's sometimes we always say, when it comes to health, be gracious to people, because you don't actually know what they're going through, and sometimes dismissing some of these things, just saying it's just psychological, you know, they don't have anything, there's nothing there, you know. Or like someone says, I'm so stressed, oh my god, my asthma, and they're like, stress, asthma, no. You know, so it can't, you know, it can't, stress can trigger your asthma, as we've mentioned before. So it's not really a psychological condition. It's not like something in the brain that if you press it, it will just go. No, asthma is real. You know, it is something that actually happens.
Yeah. Okay.
Yeah.
Okay. I think there was actually sometimes some people say that asthma has no effect on like pregnancy. But in pregnancy it can actually make it worse. So if you're pregnant, I think it's important, like, you go for your asthma check, speak to your
Checks,
nurse, because
yes.
sometimes, especially like during the later stages of pregnancy, your symptoms can become sometimes even worse. So
Worse, yeah.
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 Yeah, so it's best to speak to your nurse or something when you are pregnant and asthmatic as well, you know?
Yeah.
Yeah.
I suppose also it's
Um,
worth mentioning that if you get diagnosed with a new condition and then you realize that your asthma symptoms are either worse or you're getting maybe frequent attacks or frequent sort of flare ups, it's worth maybe talking about this with your healthcare provider just to see, because certain conditions can actually worsen your asthma as well.
asthma.
So if
Yeah.
you've just recently been diagnosed with something new, and that is possibly what is causing the flare up, there is ways to manage that. So it's just worth noting that. So if you have a new diagnosis
Yeah.
and you notice your symptoms are getting worse, don't ignore them or don't think, oh, it's just no. It's probably there could be some
Yeah.
some relationship between the two. So just speak to your healthcare professional provider.
Yeah.
Yeah.
Yeah. Yeah, I think it's important you mentioned that, especially when it comes to asthma attacks as well. Like, if you are having an asthma attack,
Yeah.
obviously make sure that you use your reliever. You
Yes.
can't use it probably up to 10 puffs, but if this is not relieving your symptoms, you do need to call, 999 emergency, because
Yeah.
that means that you need interventions. So if you are having an asthma attack, make sure you always to be honest, the most important thing, always make sure you carry your inhaler with you. That is the
Yes.
number
Yes.
one. Make sure you carry your inhaler, because once you're having an asthma attack, you need to have that puffer. You need to
Without
have that
it,
puffer
could
just
be
to relieve
fatal.
it. Yeah.
Yeah. No,
Yeah.
definitely.
Obviously, it
Definitely.
is important to stay calm, but always make sure you have your inhaler with you. If the inhaler is not helping, please do call for emergency, okay? So that they can
Yeah.
take you to the
100%.
hospital. Yeah.
Uh,
Yeah. One
I
thing
think,
actually I would say about asthma attack. If you are someone that is having like maybe a lot of frequent asthma attacks, it is
yeah.
important to go and speak to your asthma nurse or the doctor, because
Yes.
that means that they will need to review your medications. It's probably
That's
the
it.
inhalers are probably not effective. Yeah. So if you're
That's
having, I
it.
would say even like having like 2 asthma attacks in a year, that is not good. That
No.
is not good.
No.
Yes.
No. Yeah.
Yes. Okay.
If you find that also you're taking, like, maybe you have steroids or antibiotics that you're given as a sort of like, as for emergency, if you find that you're using those quite often, that already
Yeah.
shows that your asthma is not very well controlled. So if you're using that
Yes.
rescue medication quite often, no, don't just get comfortable with taking medication. Speak to someone about it. There could be an for them to just check what exactly is going
Yeah.
on, or just to basically review your asthma medication and see if it's actually what is suitable for you.
Yeah.
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 I think we've mentioned quite a bit about asthma, but what we've said is we will provide maybe links as to how
Yeah.
or on videos as to how to use your inhalers
Yeah.
or any extra information. So please look out our YouTube and our Instagram. If you have any questions, by all means, send us a direct message, send us an email. We will most likely respond to you. Just because, as we said before, asthma is very tailored to individuals. So what we've spoken to them might not necessarily relate to you, but it doesn't necessarily mean that there isn't an answer for you. So by all, if there's any questions you have or any concerns you have about your medication that we haven't touched on, please get in touch. So what is your take-home message when it comes to asthma, Steph, in regards to the topic?
Okay. So asthma, it's a condition affecting millions of people worldwide, as we mentioned. The most important thing I would say to people is that make sure that you identify what your triggers are and avoid them. If you know your asthma is being triggered by medication, by animal, by pollen, by
Yeah.
the weather, yeah, that sort of thing, the obvious thing to do is just to avoid them. Once you have an asthma as well, and you will be put on a tailored medication treatment. So
Yeah.
once you've been given these inhalers, what I would urge people to do is to use your inhalers regularly. It's so
Yes.
important. Use it as it's been prescribed, because there's no point in having that inhaler and it's in your purse. That is not going to do you any good. Make sure that you use it regularly, especially if you're on a preventer. It is most important to use it every day. Just because you're not experiencing a symptom today doesn't mean that your asthma symptoms has been resolved. The preventer is the one helping your asthma symptoms to not develop. So
That's
make
it.
sure that you use it every single day. It's so important. Very, very important. And the other thing is make sure you go for your asthma review. It's so important. At least once a year, make sure you speak to your asthma nurse, to your doctor, just to make sure that you're on the right treatment, just to make sure that your asthma is not getting worse. A lot of people think that when they have asthma, they cannot live a normal life, but you can. With the
Yeah.
right treatment, you can live a normal
100%.
life. You just need
Yeah.
to follow the treatment plan that has been provided to you, which can help you live that life that you need to. So always, always, always follow your treatment plan and listen to your healthcare providers. So what would be your take-home message for our listeners out there?
So my take-home message on today's episode is that asthma is manageable, but managing asthma involves a combination of strategies. And we have mentioned this probably several times already in this episode, but every treatment is tailored to each individual. So just know, first of all, what your triggers are. It's very important, very, very important. We always say this, identify and avoid your triggers whenever of
Yeah.
course possible. We're not saying don't go out there, don't go to work. No, no, no. Guys, we did not say quit your jobs. No, no, no. Just try to identify them, and then you can work around them. And also maybe keep a record of your asthma symptoms and triggers in a diary. Maybe if you have an asthma diary, it might be useful just to have one of those, because then you get to see exactly the sort of like patterns and like any sort of like things that could cause your flare up or your triggers. But asthma is manageable. We have, we've said to you before that there is no cure, but there is management for asthma. So just remember, with proper management, asthma can be effectively controlled, and of course this will allow you to live a healthy and active life. So don't think that this is the end, or you can't, if you love the gym or you love running or anything like that you can't do it no more. No. This asthma should not prevent you from getting on with your life. As long as you speak to your healthcare professionals and you're able to identify ways to manage it, it is 100% manageable.
Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.